Hi friends, good evening and welcome to my channel Mokambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam, also ESIC, DSSSB, AIIMS NORCET, DME exam, Insurance Medical Service exam, Kerala PSC exam. In yesterday's video we discussed questions from psychiatric nursing. Today again we can continue the same psychiatric nursing question. And the first question, who is the father of modern psychiatry? And our options, option A, Benjamin Rush, option B, Philippe Pinel, option C, Emmeline Kraepelin, and option D, William Duke. Father of modern psychiatry is option B, Philippe Pinel. Option B is the correct answer. And the next question, who is the father of American psychiatry? First question, father of modern psychiatry. This is father of American psychiatry. Options, Benjamin Rush, option B, Philippe Pinel, option C, Emmeline Kraepelin, option D, William Duke. Father of American psychiatry is Benjamin Rush. Option A is the correct answer. Father of modern psychiatry is Philippe Pinel, and father of American psychiatry is Benjamin Rush. Next question, who coined the term schizophrenia? Options, option A, Eugene Blower, option B, William Duke, option C, Carl Menninger, option B, John Weber. The term schizophrenia was coined by option A, Eugene Blower. Schizophrenia is a functional psychotic disorder characterized by disturbance in thinking, mood and behavior. And the next question, verbal utterance that are often absent is known as options, option A, palilalia, option B, copulalia, option C, echokinesis, option D, agoraphobia. Here the patient is using verbal utterance, that is involuntary words which are insulting. Okay, that is insulting words that the patient is using, that is known as corpolalia. Option B is the correct answer. Here first option, palilalia means repeating one's own sound or words is known as palilalia, and option C, echokinesis means imitating someone's movement, others movement is imitating, that is known as echokinesis, and agoraphobia means fear of open space or fear of alone in public place. Okay, fear of open space is known as agoraphobia. And the next question, Roja's projective test is designed to measure options, option A, unconscious intention, option B, dreams, option C, conscious desire, option D, brain size. Roja's projective test or Roja's ink blot test is a method of psychological evaluation. Here, the psychologist used to measure unconscious intention, thereby can evaluate personality, characters and emotional status of the patient. So, option A is the correct answer. Roja's projective test is used to measure unconscious intentions. And the next question, Indian Lunacy Act came in. Options, option A 1912, option B 1918, option C 1922, option D 1928. Indian Lunacy Act came in 1912. Option A is the correct answer. And the next question, district mental health programs was started in the year. Options, option A 1989, option B 1992, option C 1995, option D 1999. District mental health program was started in the year 1995. Option C. And the next question, World Alzheimer's Day is on. Options, option A October 10, option B September 10, option C September 21, option D October 21. World Alzheimer's Day is on September 21. Option C is the correct answer. And the next question, touching one's body without consent is known as options, option A battery, option C B fraud, option C breach of confidentiality, option D harassment. Question is, touching another person's body without their permission is known as known as battery. Option A is the correct answer. Battery means an intentional and wrongful physical contact with another person's body, that is purposeful physical contact to another person, that is known as battery. It for example, some offensive touching or making some injury, all are some examples for this battery. And the next question, clang association means impaired verbal communication, option B risk of violence, option C ineffective health maintenance, option D disturbed sensory perception. Here question, what is the meaning of clang association? In psychiatry, clanging usually refers as mode of speech by a person. That is how the person is using the word or how the person is framing the sentence. So it refers to a method, a type of speech. Okay, so the speech or the sentence framing all will come in verbal communication. So option A is the correct answer. Impaired verbal communication. Clang association means impaired verbal communication. And the next question, part of the brain that is responsible for emotional aspect of behavior is options. Option A cerebellum, option B limbic system, option C gyri and sulcus, option D cerebrum. Which part of the brain is responsible for emotional aspect of behavior is limbic system. Option B is the correct answer. And the next question, part of the brain that regulates cognitive function is options. Option A cerebrum, option B cerebellum, option C limbic system, option D pons. Which part of the brain regulates cognitive functions? Okay, correct answer is option A cerebrum, which regulate cognitive functions. The next question, confabulation is a disorder of options. Option A perception, option B thought, option C memory, option D mood. Confabulation is a disorder of memory. Option C is the correct answer. Confabulation means the patient fill the gap in his memory by making his own. Okay, that is the patient makes some stories to fill his memory gap. First option, perceptual disorder, is illusion and hallucination. And the next question, intense elation of mood with delusion of grandeur is known as options. Option A euphoria, option B elation, option C exaltation, option D euthymia. Intense elation of mood with delusion of grandeur is known as exaltation. Option C is the correct answer. Euphoria means here the patient has a constant sense of pleasure or feeling, that is euphoria. Elation means it's a joyful affect and the patient motor activity level will be increased. Okay. And euthymia means it's a normal mental status or normal mood, that is euthymia. And the next question, emotion can be best expressed through options. Option A gestures, option B language, option C posture, option D all of this. Emotion can be expressed through all the manners. Option D will come correct answer. Emotion can express through gesture or languages or by posture. All will be come as correct answer.